Hello everyone, welcome to another session of Nurse Talk. Today we are going to see the occurrence of heart sounds. All of us know when we auscultate the cardiovascular system, we can hear two heart sounds, lub and dub. So what is it? Do we have any other heart sounds or when is it audible? In today's session, we will learn about heart sounds and the cardiac cycle. So, here you can see in the image, we can see two heart sounds mentioned here. One is lub and one is dub. So, the lub heart sound or the first heart sound is heard during the closure of mitral or and tricuspid valves. So the mitral valves and tricuspid valves, we all know mitral valve is present on the left side of the heart between the left atria and left ventricle, and tricuspid valve is present on the right side of the heart between the right atria and right ventricle. This is the tricuspid and this is the mitral valve. So remember, the first heart sound is occurring due to the closure of mitral and tricuspid valves. It is easy to remember if you learn it like atrioventricular valves. Remember, first is A. First heart sound is occurring due to the closure of atrioventricular valves, and the atrioventricular valves are tricuspid and mitral valves between the atria and the ventricle. So it marks the start of systole. So systole and diastole. Systole is the contraction of the heart. Systole means contraction of the heart and diastole means relaxation. So this shows the contraction of the heart and it is heard on the apex of the heart. We have learned in detail about the apex and base of the heart, and in this session itself I will show you where are the auscultation points. Okay. So the first heart sound is lub. It is heard due to the closure of atrioventricular valves, the valves between the atria and ventricle, and they are mitral and tricuspid valves, and it is the start of systole or contraction. The second heart sound is dub, that is the S2 or the second heart sound, and the second heart sound is occurring due to the closure of aortic and pulmonary valves. We all know from the left ventricle the blood pumps out through the aorta to different parts of the body, and there is an aortic valve there. So this is the aortic valve, and pulmonary valve is the valve or the pulmonary artery carries deoxygenated blood from the right ventricle to the lungs, and there is a valve in here, that is the pulmonary valve. So the second heart sound is occurring due to the aortic and pulmonary valves. And when the first heart sound shows systole, the second heart sound is going to show the diastole or relaxation of the heart, and it is best heard at the base. Base is here on the top, apex is on the bottom of the heart. Okay, so we have mainly two. This is the normal heart sounds. Okay, we mainly have two normal heart sounds. First is the lub heart sound, that is occurring due to the closure of atrioventricular valves, that is the tricuspid and mitral valves or bicuspid valves. And the second heart sound is the dub sound, that's occurring due to the closure of aortic and pulmonary valves, and that shows the diastole. Okay, so now you got an idea about S1 and S2. Honestly, we have another two heart sound, S3 and S4. When we are preparing for the competitive exams, it is very important to know this two heart sound as well. The third heart sound or S3 is also known as ventricular gallop. Ventricular gallop. Of course, due to the rushing of blood through the ventricle filling, it is occurring. An S3 heart sound is occurring due to the rushing of the blood during the ventricle. When the ventricles fills, there will be a rushing of the blood, and that's why this ventricular gallop or the S3 heart sound is heard. And this can occur in heart failure or ventricular regurgitation. So this can also be occurring in ventricular regurgitation or any heart failure patients, but this condition, or this is not a condition, this heart sound or S3 heart sound is normal in individuals less than 30 years. So remember, the ventricular gallop or S3 heart sound is normal in individuals with less than 30 years of age, and this is occurring due to the rushing of blood to the ventricles. And now we move to the fourth heart sound. This is a physiological atrial sound. This is called atrial gallop. So in case if you get a question, which among the heart sound is an atrial gallop, the heart sound is S4 and ventricular gallop is S3. Remember, ventricular gallop is S3 and it is normal in individuals less than 30 years. It can be heard in patients who is having heart failure. And S4 is another heart sound and it is atrial gallop and it is a physiological atrial sound. And it is produced during the atrial systole of resistance. This is during the atrial contraction. When the atrial contraction, this heart sound is produced due to the resistance. And this is audible in pathological conditions. It can be seen in pathological. So, if you hear atrial gallop, evidently for any patient, you can imagine there probably a chance of any pathological disease condition for a patient who has S4 or atrial gallop sound. So we learned about 4 heart sounds here, S1 and S2, which is normal for everyone. Everyone has S1 and S2. Then we learned about S3 and S4. S3 is ventricular gallop and it is normal in individuals who is less than 30 years of age. And S4 is atrial gallop, can be a pathological condition. Okay, so these are the main heart sounds. And in detail, if you go to the heart sound, what will be the duration of these heart sounds? So, the first heart sound or S1 or lub sound, the duration is 0.10 to 0.17 second. This is heard in the apex of the heart. Remember, apex of the heart and the duration is 0.1 to 0.17. 0.1 to 0.17 is the lub sound. And the dub sound, the duration of dub sound is 0.10 to 0.14. It's very, very similar, but just a difference in 0.1. Here it may be 0.17 second and this is maybe 0.14 second. So that is all the time or the duration of the heart sounds. So now we learned about the heart sounds and now we're going to see where can we auscultate the heart sound. Which are the areas where we can auscultate the heart sound. So we all know there are some positions where we can auscultate the heart sound. Here is the auscultating areas. First one, the auscultating area is the right intercostal space. We are going to feel or hear, listen to the heart or listen to the heart sounds in. First one is the aortic area and is a right intercostal space. Second one in the pulmonic area and it is to the left side and second intercostal space. Then comes the Erb's point. Erb's point is between the left side, third intercostal space in here. And then the tricuspid, it's the left lower sternal border, fourth intercostal space. And the mitral is heard in the fifth intercostal space. Okay. So how can we remember this? Remember this mnemonic, ape to man. So aortic, pulmonic, Erb's point, tricuspid and mitral. So this is the order where we are auscultating. So remember, first 2 is second intercostal, right and left second intercostal, and Erb's point is on the third intercostal. Two-man or T, the tricuspid is on the fourth intercostal and mitral is on the fifth intercostal. Very, very easy to remember. 2, 3, 4. 2, 3, 4, 5. And remember the first and the second, aortic and pulmonic, are heard in the right and left second intercostal space. Okay. So this is how we remember the auscultating places, like the spaces for auscultation for a patient who is having any cardiac issue. So this is how we auscultate. These are the positions where we listen to the heart sounds. Okay. Now we learned about the normal heart sound. What is a murmur? Have you heard about the murmurs? If you have worked in the cardiac department or in the emergency, you might have came across the term called murmur. What is it? The murmur is a blowing, whooshing or rasping sound heard during the heartbeat. Along with the heartbeat, when we listen to a heartbeat, we can actually hear a blowing, whooshing or rasping sound along with the heartbeat, and it is sound caused by the turbulent blood flow through the near heart valve or near the heart. Somewhere near the heart, if there is any turbulence, these murmurs are heard. There are actually two types of murmurs. First one is functional murmur or physiologic murmur. Second one is pathological murmur. So what is the functional murmur? This is due to the physiological condition outside the heart. Something happened outside the heart and that effect is actually affecting the heart. So this is called functional or physiological murmur. And pathological murmur, we already know pathology means a disease condition. So pathological murmur is heard due to the structural defects in the heart. If the patient has any defect in the heart, that is a then we hear a pathological murmur. So these are the two types of murmurs. Okay. Now we'll move through the cardiac cycle. Cardiac cycle. Cardiac cycle. What is the cardiac cycle? The events occur in the heart from beginning of one heartbeat, first heartbeat, to the beginning of next heartbeat. Okay. So first heartbeat starts here and then the lub sound is here and dub sound here and then it's again going to the lub sound. So this is the cardiac cycle. It happens like a cycle and it always rotates and rotates. It never stops. So that's why it is called a cardiac cycle. So this is the events starting from the beginning of first heart sound to the beginning of next heartbeat. Okay, it consists of systole and diastole of atria and systole and diastole of ventricle. So what is systole means? Systole means contraction. Systole means contraction and diastole means relaxation. So it says it consists of systole and diastole of atria and systole and diastole of ventricles. So all the things happening in the heart during a heartbeat is coming under a cardiac cycle, and because it rotates, it like happens all the time, it is coming, we will call it as a cycle. Okay, so systole and diastole in atria and systole and diastole in ventricle comprises a cardiac cycle. So the cardiac cycle, the normal duration of a cardiac cycle is 0.8 seconds. Don't worry when you see this image. Okay, it's very easy. Very easy. I'll explain it. See the time here. 0.8 second is the normal timing occurring in a cardiac cycle. So now in this image or in this diagram, we are going to divide the timings for ventricular systole and diastole and atrial systole and diastole. It's very easy. Remember, atrial systole, the time required for an atrial systole is 0.1 second and atrial diastole is 0.7 seconds. How you know that? I already said the cardiac cycle consists total time required for a cardiac cycle is 0.8 second. So if the atrial systole takes 0.1 second, obviously the rest of the time is taken by the atrial diastole. Here see the atrial systole in here. Here is the atrial systole happening in 0.1 second. So this is 0.8 second in total. So the rest of the time atrial diastole is taking 0.87 second. See that? The inner diagram in here shows the atrial. It shows the atrium. So atrial systole takes 0.1 second and atrial diastole take the rest of the time, that is 0.7 second. This has been asked in a couple of times in different questions. So just remember, atrial systole and atrial diastole together it makes 0.8 seconds. So we are dividing it. Atrial systole takes only very little time. It will only take 0.1 second and the rest of the time is taken by atrial diastole. Okay, so now we got the idea of the inner circle in here. We are going to the ventricles. The ventricular systole, the time taken for a ventricular systole is 0.3 seconds. Here 1, 2 and 3. 1, 0.1, 0.2 and 0.3. See the three compartments for ventricular systole is here. So the ventricular systole takes 0.3 second. So obviously how much will the ventricular diastole going to take? It is 0.5 seconds because 0.3 plus 0.5 is 0.8. So in total, the total time required for cardiac cycle is 0.8 second. So I already said if for a cardiac cycle, it consists of both the systolic and diastole of atria and systole and diastole of ventricle. Okay, I'll say that again once more. Never get confused. This is very easy once you know it. Okay, so the total time taken is 0.8 second. The inner circle in here shows the atrial systole and atrial diastole. So atrial systole only takes 0.1 second and the rest of the time 0.7 second is taken by atrial diastole. Meanwhile, the ventricular systole takes 0.3 seconds and ventricular diastole takes the rest of the time, that is 0.5 seconds. Remember, atrial systole 0.1 second, atrial diastole 0.7, total is 0.8. Ventricular systole takes 0.3 second, ventricular diastole takes 0.5, total 0.8 seconds. So the total time required for a cardiac cycle to finish is 0.8 second. Hope you got an idea of the heart sounds, abnormal heart sounds, places for auscultation and cardiac cycle. We'll go for a small revision again in here. Okay. So we were discussing about the lub sound and dub sound. The lub sound is the first heart sound and it is occurring due to the closure of atrioventricular valves or tricuspid and mitral valves, and it is heard in the apex of the heart. And next, dub sound or the second heart sound, it is occurring due to the closure of aortic and pulmonary valves, heard at the base of the heart, and the duration for the lub sound is 0.10 to 0.17 second. Duration for the dub sound is 0.10 to 0.14 second. Then we listened to the S3 and S4. S3 is also known as ventricular gallop. Ventricular gallop seen in patients with heart failure, normal for adults less than 30 years of age. It is occurring due to the rushing of blood into the ventricles. And S4 is atrial gallop. Atrial gallop. So this is a pathological condition. In case the patient has any pathological condition, the atrial gallop is seen. Then we studied about the auscultation of the heart sound. Remember, ape, two-man, aortic, pulmonic, Erb's point, tricuspid and mitral. These are the places where we can auscultate to listen to the heart sound of the patient. And remember, A and P in the second intercostal, left and right respectively, aortic and pulmonic in the second, and Erb's point in the third intercostal, tricuspid T. Tricuspid is for the fourth and the mitral is for the fifth intercostal space. Then we learned about the murmurs. There are two types of murmurs, that is a functional and pathological. The functional murmur we can hear during the auscultation when the patient is having any abnormalities in the nearby structures of the heart, like the lungs or any other structures. If the patient has any issues that can affect the heart sound, that is called a functional or physiological murmur. Then we learned about the pathological murmur. The pathological murmur is due to any defect in the structure of the actual heart. If the heart itself is affected, we can listen to the pathological murmur for a patient. Then we learned about the cardiac cycle. We said that this question has been asked once. What is the total duration of a cardiac cycle? This question has been asked. The duration of a cardiac cycle is 0.8 second. Remember, it consists of one cardiac cycle consists of atrial systole and atrial diastole, ventricular systole and ventricular diastole. This in total is 0.8 second. So atrial systole will only take 0.1 second. Meanwhile, atrial diastole take the rest 0.7 second. Ventricular systole will take 0.3 second for the time and the ventricular diastole is going to take 0.5 seconds. So in total, the 0.8 will happen. So that is the total duration. This has been asked many times. As I am saying again and again, the total duration of a heart sound is 0.8 seconds. Okay. I hope you got an idea. And then just an add-on to this point, what is the normal heart rate? Normal heart rate is 60 to 100 beats per minute. If you remember the class on the cardiac conduction system, we were discussing about the SA node, AV node and all. That time I already said the normal heart rate, that is 60 to 100 beats per minute. Imagine if the heart rate is more than 100. That means the heart is beating very fastly. This is called tachycardia. Tachycardia means the heart rate is more than 100, and imagine if the heart rate is less than 60, this is called bradycardia. Okay, this is very important terminologies. I hope you all of you might know these two terminologies, but remember we need to learn it in detail, because when we are going to the disease conditions of cardiovascular system, we have to learn about tachycardia and bradycardia. So tachycardia means if the patient's heart rate is more than 100, it is tachycardia, and if the patient's heart rate is less than 60, it is called bradycardia. Okay, so I hope you enjoyed the video, and I hope you liked the video. Thank you very much for watching, and I'll see you in another session with another interesting topic. Thank you very much. Bye bye.